Mr. Wyden.
Thank you very much, and I want to thank Senator Grassley for the chance to work with him on that important bill, and look forward to working with our colleagues on it. Dr. Mostashari, let me start with you, because as you know, we're asking a lot of the Center for Medicare and Medicaid Services in the days ahead. And we're obviously talking about medical records today, and just talking with Senator Stabenow, sometimes you feel in discussing these issues that it doesn't even resemble English, that if you parachuted in, you would be trying to figure out what in the world we're talking about. So let me start with a question for you, Dr. Mostashari. How would you assess the quality of the computers today at the Center for Medicare and Medicaid Services?
I don't think that I have enough experience with the computer systems at the Center for Medicare and Medicaid Services to be able to answer that question. I don't know if Dr. Conway would.
Well, I wanted to ask you, because it's kind of a lead up, and maybe we'll get into some other areas that would shed some light on it. Now, you mentioned that, and I quote here, you're encouraging institutions that have health data to make it easier for patients to gain easy electronic access to their data and to use that information in ways that improve their health and health care.
Yes.
Do you believe that CMS is one of those institutions?
In fact, I believe that CMS is a key institution for doing so. And my mom, who I have healthcare proxy for, downloaded 3 years of every claim submitted on her behalf and paid on her behalf from Medicare. And that information on her smartphone and on my smartphone has actually been really revolutionary in terms of us being able to manage her care better. So I think CMS...
That would be a statement that the CMS computers are not exactly in the dark age. Would that be fair to say?
They have done a great job allowing the CMS Medicare Blue Button to be available to all 37 million Medicare beneficiaries.
All right, so we've made some headway on the patient side, and I think that's clearly a plus. We also are hearing continually from providers that they are waiting for their data, that they're having problems getting it. And we touched on this a little bit at our hearing last week. This is a hugely important point, as you know, because right at the heart of the bill is the concept of shared savings. What we want to be able to say to providers all over the country, and there is great bipartisan interest, in this, that when you do well, when you're able to give good quality care at more affordable prices, you will, in fact, get to share in the savings. It is locking in a set of incentives that have not traditionally been in fee-for-service. It's pretty hard to tap the potential of shared savings if the providers keep reporting to us and our various staffs that they can't get their data. So what's your take on that, Doctor, and what do you think we can do to make sure that the providers can also get their data in a timely kind of fashion? You've told me something that I think is plenty useful this morning. You said your mom essentially got a lot of useful data in a fashion that was helpful to her, but I'm still getting complaints and concerns from providers. So what's your take about how we turn that around?
Well, I will allow Dr. Conway to answer, but providers are now getting more data from Medicare than they ever have before through the shared savings programs, the new CMMI programs, and also through, I think, the important measure in 10322 of qualified entities who can receive Medicare data for the purpose of benchmarking and providing assistance to providers. So I think this, the Affordable Care Act provided important enablers of better data sharing, and it's much improved compared to where it has been. I'm sure that there are ways to be improved, but it is better than it ever has been, I believe.
And just briefly to build on that, through our various payment models, we do have monthly data feeds now, for example, in the Medicare Shared Savings Program, Pioneer ACOs, and a number of payment models. That is much better in terms of frequency than previously, as you may have heard. And to build on the previous point on technical assistance, I think we would welcome the opportunity to provide technical assistance about, for what level of resources we'd be able to achieve, what level of data feed to what percentage of providers in America. So we'd welcome the opportunity to work with you on this critical issue.
My time is up. I'm going to ask you to get back to me on the record, Dr. Conway, about a statement in your testimony. You talk to the point with respect to the vendors sharing information, because we obviously have to hold the vendors accountable. You state, and I quote, "We recognize that some providers and electronic health record vendors may not have a business imperative to share health information about across providers and settings of care." Now, that's a pretty troubling statement, because taxpayers have billions of dollars into making this work, and the vendors have seen enormous growth since 2009. I think we need to know more, and specifically, I'd like it in writing, how you're holding these vendors accountable, because that money is out the door. As Chairman Baucus talked about, it is huge sums. And so can you get back to us, say, within a week on that? Dr. Conway?
We can commit to working with the Office of National Coordinator to get back to you, and we will try to meet that time frame.
Great. Thank you, Mr. Chairman.
Send that to the committee.
Yes, that's what I meant.